Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Bethanechol. Bethanechol is most resistant to hydrolysis. It is most resistant to hydrolysis. It can act on GIT and bladder, mainly on M3 receptor. It is used in post-operative, postpartum urinary retention, and in certain cases of hypotonic bladder or myogenic bladder, or it can be used in neurogenic bladder. Adrenergic agonists are useful adjuncts in resisting the outlet resistance of internal sphincter. In order to reduce the outlet resistance of the internal sphincter, these adrenergic agonists are better. Adrenergic agonists are used as adjuncts for decreasing the resistance of internal sphincter. But here the bethanechol is actually used in also used in post-operative abdominal distension, and it is also used in gastric atony, and it is also used in gastroparesis. Prokinetic agents with right now we are not using these bethanechol can be used for post operative abdominal distension and gastric atony and gastroparesis, but now this is actually replaced by prokinetic agents like metoclopramide are mainly used for this gastric abdominal distension and gastric atony. Right now we use these metoclopramide or prokinetic agents which contain cholinergic agonist and dopaminergic agonist activities. Bethanechol is also used in Hertzsprung disease, and it is used in achalasia cardia and post-operative urinary retention.
thank you and thank you for watching.